welcome back to another segment on the BWT-African Africa Rising channel. Now, in the next 1 month, Ghana is going to be flooded with a number of hospitals spread across its 16 regions and 216 districts in the country within, well, I said 1 month, but the next 18 months. That's when it will be completed. The West African giant in economy and many other things has recently begun what it is terming as Agenda 111, which is to build about 110 new hospitals and revamping others. This is massive, so yeah, we're going to tell you as to the whys, the hows, and wheres, and obviously the whens shortly after this break. We'll be right back. So yeah, welcome back. My name is Bernard Buama, your host for the BWT-African Africa Rising channel. Before we dive in, let me take some time and some opportunity to remind you that this program is probably sponsored by Webnation Africa. Yeah, you can actually go there and read a lot of news. You can log into the website and get all your entertainment news and positive news about Africa. Yes, you can also actually subscribe to their YouTube channel. Yeah, they are sponsoring us, Webnation Africa. Yes, that is it. You can also download their mobile app on Android. Yeah, the iOS version is coming very soon. So yeah, Android users, yeah, it's your time. Just go there quickly. Let me also talk about our second sponsors, Zeonam.com. Just go there. For all your goods. Oh my goodness. Utility goods, from gadget, from everything. Zeonam.com. Your number one intercontinental trade. Website. Just go to Zeonam.com. Zelanam. Yes, and get all your affordable and yet quality goods. So yeah, moving on. Well, obviously, the almighty COVID-19 pandemic has taught the world many lessons, and yeah, as civilized people of the 21st century, we have greatly adhered to the preventive measures in dealing with it.
I get corona. At the end of the day, I'm not going to let it stop me from partying.
Yeah, and so due to the world's fantastic measures, this disease will clearly not be leaving us anytime soon. Yeah, this virus, well, take it as your admirable uncle, your uncle that you really admire, that came for the short winter break but ended up spending the entire summer, clearly overstaying its welcome. Yeah, so lesson number one, let's go into it. Lesson number one, COVID isn't leaving us anytime soon. And two, Africa's health system isn't as bad as the Western world anticipated. Who wasn't scared about the alarming forecasting that, well, the BBC and the Adjaye televised concerning how devastating COVID-19 will be for Africa? Even worse, this French doctor blatantly on live TV interview had to propose that the cases on the continent will be so great that Africans will have to be used as guinea pigs for any COVID vaccines that will be developed. Well, apart from the fact that the doctor isn't the most masculine of all male doctors that you ever see. If he's not handsome, then Well, so his claims, together with other million Western forecasters, were far from the truth. COVID was aggressive in all parts of the world, yes, not just in Africa, and we would say that Africans might have gotten off the hook with China in terms of death rate. But that's not to downplay, the relevance of the basics of their assertions. Yes, they were talking about a whole lot of Africa's dilapidated healthcare system, but it isn't as bad. That's what I want you to know. Health care and health facilities in Africa has been a challenge for some time. Not as worst, like I'm saying, but somewhere in between life support, and we are not dead yet. So yeah, there's still hope. Speaking of health system in Africa, South Africa, which is Africa's most advanced country in terms of healthcare, is ranked 49th on the World Health Organization Global Health Index with a score of 54.8. Kenya, with a score of 47.1, is ranked 67 globally and second on the continent of Africa. In as much as we might not be able to go into the detail to know the scheme used to come up with those rankings, we would have to admit that our health systems need a massive revamp to tackle the bread and butter health issues and to also tackle other emergencies like COVID, Ebola, and others. And bam! There comes Ghana, always trying to set the pace in modern Africa. Let me start on the premise that Ghana's current World Health Organization health index of 35.5, well, that's pretty low, would place them somewhere between 120 to 150 on the global health index, perhaps 20th on the African index. Even though the country boasts of close to 3,100 health centers, out of which 1,800 are state-owned and 1,300 are owned by private entities, and also, how Ghana became so popular, during COVID time. The recent additions, which is set to give over 100 districts in Ghana a state-of-the-art government-run health centers, would be a massive boost to the country system and the global health index. Yeah, that would be a bonus point, What else? And also, speaking about the health systems, Ghana has been one of the countries that greatly dealt with COVID-19. I mean, when COVID was raging havoc, Ghana's president was on the news everywhere. In terms of some of his utterances, the famous, we know how to bring back the economy. What we don't know is how to bring the dead people back to life. I mean, it goes to sometimes if you're a Ghanaian and you're walking on the street, man, you lift your shoulders high and people will be like, what's up? And you'll be like, yeah, I'm from Ghana. Just like that. Those that laugh hookup were just getting it left and right. Yeah, just like that. So yeah, moving on. In as much as this is going to improve the accessibility of affordable health facilities in the country, a greater part of the country's unemployment among health workers will be tackled head on. As of 2016, yes, Ghana's physician to population ratio was 1 to 84,000, while the hospital beds per 1,000 people stood at 0.073. I mean, not bad in West Africa, but not the optimum globally. So yeah, improvement is necessary. These ratios are likely to be way improved after the completion of these hospitals. For a country that has received its fair share of COVID-19 crackdowns, with about 115,000 infections and close to 974 deaths, and resulting economic difficulties, the gigantic funding that will be needed for this ambitious project to be completed is a major concern. Each of the proposed 111 is expected to cost about $60 million, 12 million for construction and 4 million for equipment installation. So multiplying that by 111 will be resulting in a figure close to $1.9 billion. Huge. As we speak right now, the government of Ghana has secured about $100 million to commence the constructions of the first 88 out of the 110 district hospital, which is set to be completed in 18 months. I mean, the $100 is just for the beginning. I mean, not for the completion, please, of the initial 88. So moving on, these hospitals, which is covering about 15 acres of land area each, are not just going to be huge, but also fully furnished with state-of-the-art facilities and unparalleled outpatient service centers, ophthalmology department, dental and physiotherapy, and imaging services centers. I'm sure that's where you take your photos to be used for your hospital ID cards. Yeah, I'm sure. Imaging centers. Now the good thing is that these projects are happening at the backdrop of an already improved Ghana's ambulance service system in the country. How can you build hospitals without me checking the ambulance services? How are patients going to come? Ride on bicycles or swim? So yeah, against the backdrop of, the improved ambulance services. So yeah, speaking about the ambulance services, the government of Ghana in January 2019 commissioned the operational use of some 307 ultra-modern ambulances for the health service as a means to significantly deepen and improve access to healthcare in the country. According to a report published by healthdata.org in 2019, road accident is the 10th killer disease in Ghana, and this has been so due to, of course, the roads, poor driving, and poor ambulance service operations, which used to depend on just 15 semi-operational ambulance vehicles to transport accident casualties when they need be. I don't want to enter into the details of how the ambulances has been functional in its first 2 years of operation, but clearly, if there's an obvious fact to be drawn out of tonight's segment, is the fact that Ghana isn't joking with their health system. There are some extreme scenarios like this ambulance, which is clearly being used for its true purpose. Yeah, but yeah, Ghana, the secretariat of the AFCFTA, the African Continental Free Trade Area, is clearly positioning itself to befit the title in the health sector. We haven't talked about the zipline drone delivery services of medical equipment yet. Yeah, you see that? You love it. But yeah, I'm sure you already got the idea. Or even this hospital. Man, I'm sure you're loving it. So yeah, that is the new University of Ghana Medical Center. The architecture and the facilities will blow your mind. In fact, it looks like Ghana's two main opposing political parties would disagree on anything but health facilities development in the country, which is a good thing for the country. If they now agree on health facilities, who knows what they might agree on? Stopping corruption. So yeah, speaking about health facilities, I think Rwanda is also on the rise, and Rwanda is worth mentioning. So come on, watch out for our next big news on the country, Rwanda. That is Ghana for you, stepping up big time in the health sector with new hospitals. 110 or 111 new hospitals for every district is massive. I know it's really going to change the health system and put Ghana, somewhere in between, 1 to 70 on the global health index. If only they are going to stick with the plan. Man, Africa is rising. And if we are starting from education through to health systems, who knows? Our political system might even change tomorrow. Africa is rising. It's not as bad as you think. My name is Adjaye, and this has been the Black Suit Tonight African Rising channel. You can also find more positive news on the continent of Africa on the Webnation Africa YouTube section, or you can even go to the webnationafrica.com, or you can download the Webnation app on your Android devices. Until then, see you when I see you.